Good evening, ladies. It is so nice to see you coming in. Oh, hiya. Thank you for coming so far. That's all right.
These women have spent years waiting for answers.
Lovely to see you. So nice to see you too.
I was 9 years.
I was 13.
I think about 8 years or 9 years. Yeah, and I was 14. 6 years.
9 years from 9.
I think probably about 9 years in total.
22 years before they diagnosed me.
That's crazy. That's shameful.
It was bad.
Endometriosis is as common in women as asthma and diabetes. On top of that, it costs the UK economy more than £8 billion a year. But many people still haven't heard of it.
I had, at one stage, had a terrible flare before I took any pain relief, and I passed out and I broke my wrist. But I didn't know for 2 days I'd broken my wrist because the pain from the endometriosis was so severe.
Obviously, we always start our meetings with going round the room to find out exactly who we all are.
Candice Mackenzie co-founded Endo Warriors West Lothian after she noticed a gap in support for women and those assigned female at birth who are living with the condition in Scotland.
Let's start off on a positive note. Is there any wins anybody would like to share this week that they think, I took that and I kicked that out the park? Which is anything? What about you, Diane? You've had a really complex few weeks.
I was in hospital for 12 days and I'm out and feel absolutely brilliant.
The group gives women with endometriosis a chance to be heard when they feel no one else understands.
Even if you are surrounded by people who love you and are caring and are trying so hard to support you, they can't really understand without going through it.
I'd rather just, like all of us do, get on with it and just struggle through the pain, live the life that we've got, because that's just what we've got to do. And it's heartbreaking that you've got to admit that.
Yeah.
Do you know what I mean? But for you to be able to get what you want, what you've been desperate for. Sorry? It's been a long journey. Yes, it's been really bad. But I know more now because I've got this support group behind me. I've got people in my corner. And if it does come to my daughter having it, at least I can be more of an advocate for her.
It's not known what causes endometriosis. It happens when tissue similar to that found in the lining of the uterus grows in other places, commonly on the ovaries and fallopian tubes. The cells act in the same way as those in the womb by bleeding each month. But that blood doesn't have anywhere to escape, leading to severe pain, inflammation and bowel problems.
I'm a fifth generation, but I'm the first to be diagnosed. I was told my periods were normal, not just by my doctor, but by my family. Like, all the females in my family are just like, yeah, well, just get on with it, it's normal, that's what we have. You probably need a hysterectomy early, but it's fine. When I was chatting to a colleague in the office and I'd had a particularly bad day and I was getting out some morphine, they said, oh, what's that? I said, oh, that's Oromorph. And they said, but that's what my grandmother had when she had bowel cancer and was dying.
Having endometriosis can be an incredibly isolating experience, and a lot of women feel doctors don't listen to their concerns.
I begged them to do something about it, so they said, okay, we'll give you a hysterectomy. Done a hysterectomy, and I said, now you need to take it all out. No, we can't take your ovaries out because we don't want you going through menopause, you're too young. And I still say to this day, if they had listened to me and taken everything out when they did, I wouldn't be here 13 years later. It's just so much time is lost and so much damage is allowed to go unchecked, just because let's just keep them quiet.
But keeping quiet is not something Candice is prepared to do.
We are at the back of the room, and the only way you're going to let people know that you're there is to make some noise.
She's been living with the symptoms and effects of endometriosis for 36 years.
When you finally got the name, you got the diagnosis, endometriosis, what was that like for you? Was it a moment of relief? Was it frustration that you'd had to fight for it for so long?
There's mixed emotions with the word endometriosis, because on one hand, you've been validated for the years and years of pain and dysfunction, but on the other hand, if you've done research on the condition itself, you do appreciate that the diagnosis is a grave one.
We have the worst bad nights. You could be in a slumber sleeping and you'll get the most almighty pain that will come through you and it'll wake you in your sleep. You'll go through to the toilet and it could be 5 hours and you would pray it happened to me on Thursday night, I prayed to die because I couldn't take the pain. And it's something nobody talks about, is the isolation you feel when you're in that bathroom. You lose your sense of self.
Candice has been on and off different medications for years. For a while, she was prescribed Zoladex, a type of hormone therapy.
It's crazy to think what can be written about you by a professional, you know, and this wasn't my usual doctor, but I read in one of my notes that Candice was rather upset today and seemed very disassociated with the plan. She said she didn't want to go back on Zoladex, and you're sitting reading that, and what they're not saying is why you said that. Why you said you didn't want to go back on Zoladex. You didn't want to go back on Zoladex because you nearly broke up with your husband, because your hair fell out, because you couldn't function at your work.
Candice has had 16 surgeries for her endometriosis, including the removal of her uterus, ovaries, cervix and fallopian tubes. But her pain has never majorly subsided. She believes this is because there's a general misunderstanding of the condition.
The doctors, they are doing the best that they can. We know this, but they can do better. They can always do better. They can be more honest with us. We do require honesty. We're big girls, you know. We can pull our pants up really high. We can take it. But please do not sit there and gaslight us the way that we have been, trying to make us think that if we go away and do this, somehow the outcome's going to be different. It's almost like a form of insanity, expecting the outcome to be different.
In 2021, Scotland became the first country in the UK to introduce a women's health plan, which aims to find better treatments for conditions like endometriosis. But across the boards, funding for research is lacking.
Because the research and funding isn't there for people to try and establish why this happens. We don't even know yet why we have endometriosis, so we're so far away from trying to understand why it behaves differently outside the pelvis. But we need endometriosis to be redefined as a full body condition, and its implications are vast.
My uterus and bowel were fused together. It's on my bladder, and I just sort of worry, where is it? Is it going to go up the way? You know, because it's already going down the way, it's causing problems in my legs. I've tried the hormonal treatments, I've tried the menopause and I've tried pregnancy, and none of them worked for me.
Currently, treatment options are limited. Most women are prescribed hormonal contraceptives, but they don't work for patients who've gone through the menopause or want to get pregnant.
There needs to be more research, more money, and we need to be looking at how we can do better for not even just those who identify as women, those who are assigned female at birth.
One place where there is hope is in this lab at Edinburgh University. The team here are looking at potentially the first ever non-hormonal and non-invasive treatment for endometriosis.
It's a drug that's been around for many decades. We use it to treat children with metabolic disorders, and we gave it to those patients and they took the drug for 12 weeks. And for the majority of the patients in that study, they had a very significant improvement in their pain, in their quality of life, and their need to take painkillers, particularly not needing to take painkillers such as strong opiate medications.
Researchers here are determined to improve access to treatment.
There are lots of different stages where there are barriers to getting a diagnosis, and I think one of the big ones is that we don't have a blood test, so something that can be easily done. Then the next sort of step of investigation we could do is a scan. So say you've got something like breast cancer. If you go with a lump, there are very clear referral pathways, but you can then have a scan done. And I think alongside this, there's that issue of not being taken seriously, symptoms being dismissed. I think that is improving.
Despite the work that's being done here, Dr. Whittaker says true progress in women's health also relies on breaking down stigma.
What do you think are the most important things that really need to change there to improve confidence and access to healthcare?
Normalising it to talk about periods. My father still can't really talk about periods, even though I've been working in obstetrics and gynaecology for 14, 15 years. When I talk about heavy periods, he goes slightly green. And we've got to normalise that across the board, and that comes through education. I think starting in schools, talking about periods, talking about what's talking about what's not normal. I think empowering people to seek help but also ensuring that when they do seek help that they are heard.
I've had endometriosis now for over 36 years, and I have seen massive changes in my world through technology and advancement, but I have not seen a change for endometriosis care or how to manage it effectively. And that's something that's disgusting. And we are your mothers, we're your cousins, we're your colleagues, we're your friends. And you need to look after us. You can't do that to women.